My name is Jim Nugent. I'm a physical therapist at HealthyBack. One of the unique features of our comprehensive spinal program is that we use a powerful assessment tool called mechanical diagnosis and therapy. It's called the McKenzie Method, and it was developed by Rob McKenzie, a renowned physiotherapist in the 1950s. This is a well-researched exercise-based approach that offers a comprehensive assessment, treatment, and mechanical diagnosis for our patients and offering positive outcomes for them as they go through our program. The assessment process for mechanical diagnosis and therapy always begins with taking a comprehensive history. The history then will drive our provisional classification. In order to determine that, we do repeated movements using end-range loading to find that appropriate directional preference. We can begin with an example would be double knees to chest. The client simply takes their knees and places their hands on top of their knees and draws their knees towards their chest using end-range loading. They do this about 10-15 repetitions. We're always monitoring both clinical and mechanical baselines. Another example of a repeated movement would be extension and lying. Simply, the patient is going to place their hands at the side of their shoulders here, and they're going to extend their arms fully, achieving end-range extension. And again, we're monitoring both mechanical and symptomatic baselines. Typically, the patient will do 10 repetitions. After the patient has completed a particular repeated movement, we always want to reassess both mechanical and symptomatic baselines, certainly while they're lying down, but more importantly when they're standing. So Brittany will exit the right side here, and we'll assess her forward bending, backward bending, and side glide and standing right and left. One of the unique features of mechanical diagnosis and therapy, or the McKenzie Method, is that at the end of the treatment session or the assessment session, the patient has an exercise that they can take home and use to help restore their motion and to decrease their pain. One of the therapy approaches that we use at HealthyBack is called repetitive motion therapy. The Repex machine is designed to take the person into backward bending and forward bending. It works very well with back pain as well as sciatic pain. And I'll demonstrate this right now as we take the patient through backward bending and forward bending. Some of the research has shown that if a patient has sciatica, doing this machine 3 times a week can help to decrease the patient's symptoms and to restore motion. At HealthyBack, we treat a number of diagnoses related to the neck and back. For example, headache management, TMJ, for the lumbar spine, degenerative joint disease, degenerative disc disease, sciatic, spinal stenosis. We treat patients with osteoporosis as well as SI joint dysfunction.